One embryo, one baby. That's been the goal of in vitro fertilization now for over 30 years. Unfortunately, the way that IVF has been practiced during most of that time hasn't been a very efficient process. And so we've had to replace multiple embryos, and that resulted oftentimes in multiple pregnancies just to achieve a reasonable pregnancy rate. Over the course of the next 3 videos, I'd like to document what's changed in those last 30 years, and specifically what's changed in our hands in the last 5 to 10 years, that now allow us to replace a single embryo and achieve a single pregnancy in up to 85% of cases in women under 40. The first step in the process is obtaining as many usable embryos as we can. Now we have to realize that not every woman is the same. So we need to make sure that the treatment protocol that we use is tailored specifically for the individual. This means that the number of eggs that are present at the beginning of a particular month, the FSH and estradiol levels that are associated with that, and the person's weight, age, perhaps previous treatment with injectable medications, all these things need to be taken into account when we determine exactly how we're going to treat them. We like to see the patient on the 3rd day of a natural cycle without any pre-treatment, and then determine if that month is optimal. By considering the number of follicles that are present and the FSH and estradiol levels, we can decide exactly if that month is good or if we should wait for a better one. It also helps us to plan the dosage and the type of medication that we're going to use for that particular cycle. Once the stimulation protocol has started, it's very important to do appropriate monitoring, and we do a lot of this. I'll only let my patients go for 3 days before we have them come back in for the first ultrasound and estradiol measurement. From that point on, we see them at least every other day until we start seeing them daily at the end of the cycle to make sure that we can make all the appropriate changes that are necessary and find out exactly when those eggs are ready to come out. Once the eggs have been retrieved, what happens to them in the laboratory is extremely important. The laboratory has to be a place where the embryos can be cultured till they're 5 to 6 days old and reach the blastocyst stage. In our laboratory, we've been doing this consistently for about the last 10 years. Things like the type of incubator that are used, whether there's 2 or 3 gases involved, the type of culture media that's used, the expertise of the laboratory personnel, all contribute to the ability of a particular lab to be able to grow good blastocysts for testing. Once the embryos have reached the blastocyst stage, the biopsy procedure that's performed is extremely important because this has to be done in a way that doesn't do harm to the embryo. When we were biopsying embryos that were 3 days old, we were only removing 1 cell, and sometimes this didn't give us the best diagnosis. When we have 5-day-old embryos, we can do much better because now we're able to remove 5 to 10 cells, and this has increased the accuracy tremendously. Once the cells have been removed, they're sent off for testing, and then the embryos are frozen. The freezing of the embryos is also extremely important because it has to be done in a way that doesn't harm the embryo once they're thawed. The older, slow freezing mechanisms that we used for many years didn't always do this so well or so efficiently. The newer method involving vitrification is a much better procedure that allows us to recover the embryos in a state that looks basically like they did before they were frozen. This assures us that when we replace that embryo, it has the best chance of turning into a baby as long as it's genetically normal.